Great. Hi, Reagan. How are you today?
I'm good. How are you?
I'm doing good. So I just wanted to take some time this session and talk to you about some of the tests that we took last time.
Mm-hmm.
So we did that like short little test that was just to see like a screener to see if we need to do some more,
Mm-hmm.
and we ended up taking the longer test, the YBOCS,
Mm-hmm.
and so I've got your results back on that.
Mm-hmm.
And so it says that you seem to have mild OCD, which is something we're going to work on, and we're going to talk about things that we can do today, okay?
Okay.
So
Good.
I'm glad. So when we review, I want to just kind of review what we've learned on the test before we start into what we can do. So it seemed like your biggest obsessions and compulsions had to do around cleanliness and like contamination.
Right, yeah.
So you talked about like brushing each individual tooth, washing your hands like 3 or 4 times after getting home from work.
Right, yeah.
And so I just think I would like to teach you some methods and techniques that might help you handle those better.
Okay.
Does that sound good?
Yes.
All right, so the kind of gold standard for OCD treatment is called ERP, and it's exposure and response prevention. So basically, like, you would think, I gotta wash my hands, and then we keep you from washing your hands.
Okay.
And so that can sound really dramatic right at first.
Right.
But we're gonna work our way up to it.
Okay.
So you said that anytime you kind of like see the sink on the path to your bed,
Mm-hmm.
that you think that like, I need to wash my hands.
Right.
Yes. Yeah.
Yeah.
So what if instead of like every sink that you see, you gotta wash your hands? What if like you see 3 sinks, you wash them at 2 of them at first?
Okay. Yeah.
And then we work our way down to just the one.
Mm-hmm.
Or then if we still want to wash our hands more, we maybe wash it twice at that one and things like that. So we kind of will work together to create a hierarchy.
Right.
To help you kind of process each of those obsessions and compulsions.
Mm-hmm.
And make sure that you remain like calm, and because we don't want you to like get really stressed out. Because you say that you don't mind doing your compulsions really, because it's
just like an everyday thing, you know?
Yeah, and it's like you say, it's easier just to do them than to try to fight them.
Right.
And so, overall, it seems like your obsessions and compulsions don't impact your like work function, like your social life. It seems to be affecting just kind of like your self time, like your rest time, your like relaxation and self-care time. It seems to cut into that.
Right.
And does that seem like a good synopsis of what we've seen?
I would agree.
All right, so even if you're functioning properly at work and school and social life, you still want to be able to relax yourself and be calm.
Mm-hmm.
And so that is when I'm going to teach you some relaxation techniques to do the ERP with, because we don't want to just send you like, oh, you can't compulse,
right.
But you just are going to be stressed.
Right.
There's some things that we can kind of do with you that will help make that an easier transition.
Mm-hmm.
So what I really think would be helpful is just some like deep breathing.
Mm-hmm.
Like just some like if just anytime something pops in your head and you want to do the compulsion,
mm-hmm.
just take a couple deep breaths to calm yourself down, and that also builds space and time between
mm-hmm.
the obsessions and the compulsions.
Mm-hmm.
So I just think that's something we could work on. And then the other large part of your obsessions and compulsions seems to be about somatic or like illness issues. So like things on your body hurt,
right.
And you assume it's cancer, a tumor, appendicitis.
Right.
Yeah. And so you discussed that your mom has cancer.
Mm-hmm.
And someone that you went to high school with just recently died from brain cancer.
Yes.
And so those seem to be both really on the forefront of your mind.
Mm-hmm.
And you said after those things started happening is when you started getting these more worrisome thoughts about, like...
I mean, I think I've always had them, but it's been like... No, I don't want to say like... What's the word? Like, it makes it, like, my fears are kind of like valid because like people did have the same fears as me and then ended up having cancer.
That
you
makes
know?
sense. So it's
So
like,
it's not saying that they're validated or like reassured, but they're kind of, in my mind, it's like, okay,
makes sense.
yeah, kind
It's
of.
like, you can't write them off as irrational because your mom was 48, you're,
Right. Had the same problems as me, and then,
Mhm.
you know.
and then the friend from high school, she was 17, 18.
She's 19.
19?
Yeah.
So I also think that it could be really helpful to kind of talk through those things and work those out.
Mhm.
Just in some like just talk therapy. We can discuss kind of how that whole situation made you feel, if some of your problems seem to get more, like you seem to be more obsessive and compulsive after your mother's diagnosis or anything like that.
Mhm.
So I think that's something we could explore if you're open to that.
Mhm.
And then I also, you said one of the things that you do when you're worried that you do have a tumor or something like that
Mhm.
is you make a cup of like antioxidant tea.
I do that.
Yeah. And so, I mean, overall, making tea is a good mindfulness practice.
Oh, okay, that's a good. I thought. My bad.
Yes, we're gonna kind of restructure. It's called
I see.
cognitive restructuring.
I see.
And so instead of being like, I'm drinking this tea so I don't get cancer,
Right.
we're gonna drink this tea to do something positive for you, if that makes sense.
Right. As in, like, what's an example?
Okay, so it's like we can make
Because in my mind, I'm not getting cancer.
some
So
positive things. I mean, that's true. That makes sense. So we can do kind of steering it away from the thing that we get really stressed about
Okay.
into something that like, oh, you said you have digestive issues?
Yeah.
Like, oh, this is going to make me digest things so good.
Right. Yeah.
And so that way we're not really thinking specifically like
The
tumor,
really bad thing is helping
cancer.
my health overall.
Yes.
Right.
And so also something that's really, I like just in general, I think is helpful, is mindfulness. So there's mindfulness-based cognitive behavioral therapy, which is just kind of a fancy name for things like breathing exercises and mindfulness and things we've talked about a little bit earlier. But drinking tea can kind of become a mindfulness exercise for you. There's also a lot of grounding that you can do with drinking tea. You can feel the warmth, you can see how it tastes, it smells, what you hear, like, you know.
What is it? Slurping? Sorry, like when you slurp the tea, you can hear it.
Oh, okay,
Right.
yes.
Sorry, I was like, what do you mean here?
I was thinking like the pot boiling,
Oh,
things like that.
Right.
The whole thing. So it's just being present and mindful also helps with just stress levels overall, which it seems.
Oh, so like not thinking about other things like in present moment.
Yes,
Okay.
like being
that
present,
is
and
more
that also
clear.
that also helps with, you know, being present.
Right.
Yeah. Also, so I just kind of want to go over some of the other information you gave me. You are in college right now.
Yes.
You're studying geology.
Yes.
You live at home with your mom and your dad and your sister and brother.
Yes.
And would you say you have like a good relationship with them?
Yes. Sorry, I just said yes. Done.
And then, is there any other information you think is pertinent to this diagnosis? Are you worried about it? Does it make you feel validated to hear that, or does it make you
hear what?
Hear that you like have taken this diagnostic test and seen that this is or not. It doesn't have to be. It doesn't.
Not really.
Not so much.
No, I mean, it just kind of is what it is, and I don't think it's harming it. I don't know, but I guess so, kind of.
It doesn't have to. I know you said that it's like you just think it's part of what you do.
Yeah, I kind of didn't really think of it as anything odd, but I guess people don't come home, wash their hands multiple times, and wipe their phone down with an alcohol wipe, so, you know, maybe it's not weird. Not weird.
Not weird, it's just, you know, it's just what you do. And we can kind of work on, if it gets to a point where it gets even more elaborate, you have talked about how, like, it's kind of built on each other.
Right.
And we would like to keep it from continuing to build. So we can kind of just try to I mean, there's nothing wrong with coming home and washing your hands
Right.
once. Wiping your phone down with an alcohol wipe. Right, so I think we kind of have a bigger picture and where we kind of want to go with this. Do you have any questions about any of the techniques that I've mentioned? Or how you could go out today and start trying something?
I mean, I guess, like, what are other options of mindfulness besides drinking tea that comes to mind?
Yes, so really mindfulness is, I've told people before, it can be practiced, like, in lots of things. It's just being present. One of the examples I've given in one of my classes was being present, like, on your drive to work. Because so many times it's...
Just trying to space out.
Yes, or same thing, going to and from work, it's like, it's just second nature. But you can think of, like, how you're feeling. Like, I like to drive with the windows down, feel the wind on your skin, things like that. And I mean, you can go for walks, look through nature. There's just lots of ways to, like, breathe deep, connect with your body. And those have really good research basis for mindfulness-based cognitive behavioral therapy.
Okay.
Alrighty, is there anything else that you'd like to talk about for this session?
I mean, I think I'm good. Not anything that's coming to mind.
Alrighty, that's good. Well, we will start on all that next time. Okay?
Thank you.
Thank you.